LASIK, or laser-assisted in situ keratomileusis, is a surgical procedure intended to reduce a person's dependency on glasses or contact lenses. LASIK surgery is most commonly performed as a cure for myopia or nearsightedness, but can also be used to cure hyperopia, farsightedness, or astigmatism, corneal irregularity. LASIK is a procedure that permanently changes the shape of the cornea using a special laser and thus focusing the light rays exactly on the retina. The steps of the procedure are as follows. A suction ring is placed on the eye to stabilize and check the eye pressure. The microkeratome, a cutting instrument, is attached to the suction ring. The blade of the microkeratome is used to cut a flap in the cornea. The exposed inner layer of the cornea is then reshaped with an excimer laser. The corneal flap is returned to its original position. LASIK is an ambulatory procedure. The patient can walk into the surgery center, have the procedure, and walk out again, and is awake the whole time. Occasionally, the doctor may administer a mild oral sedative.
During normal vision, light first enters the eye through the cornea, then passes through the pupil and the lens, where it is focused at a point on the retina at the back of the eye. Astigmatism is caused by a deformity of the eye, in which the shape of the cornea is more oval and asymmetric than the normal round shape. This deformity causes light to focus on points in front of and or behind the retina instead of on the retina itself, causing images to be blurred or distorted. People with astigmatism may also report frequent headaches or eye strain. Astigmatism is a very common disorder, and it can occur with either nearsightedness or farsightedness. Blurred or distorted vision caused by astigmatism can be improved by wearing glasses or contact lenses. Macular degeneration, commonly referred to as ARMD or age-related macular degeneration, is the leading cause of blindness in the United States today. During normal vision, light enters the eye through the cornea, then passes through the pupil and the lens, focusing at a small area on the retina at the back of the eye called the macula. The macula is located in the center of the retina and provides us with detailed, straight-ahead vision. It allows us to see fine details like facial features and fine print. When the macula deteriorates because of aging, a breakdown of the delicate macular tissue occurs, and objects may become blurred, distorted, and lose their color. It is also possible to see a dark or empty area in the center of the visual field. A variety of low vision devices, including telescopic and microscopic lenses, can be prescribed depending on the severity of vision loss. Central vision that is damaged from macular degeneration cannot be restored, but can be compensated for with these optical systems. The ear has three distinct parts: the outer, the middle, and the inner ear. Sound waves first travel through the outer ear into the ear canal and then vibrate the eardrum. The eardrum is connected to three tiny bones in the middle ear. The vibration is passed to the cochlea in the inner ear, where it is processed and sent to the brain. An ear infection occurs in the middle ear. Normally, Fluid in the middle ear drains down the eustachian tube and into the back of the throat. During an ear infection, the middle ear produces fluid that cannot be properly drained through the eustachian tube. The buildup of fluid can cause pain and temporary hearing loss, and it may lead to a middle ear infection. Otitis media is more common in children because of the length and position of their eustachian tubes. Management by a doctor is required.
Pathology of otitis media. When the eustachian tube is blocked due to allergy or infection in the upper part of the respiratory tract, fluid accumulates in the middle ear behind the eardrum. This causes an infection and the middle ear gets inflamed, a condition known as otitis media. The buildup of pressurized pus in the middle ear causes earache, swelling, and redness. Since the eardrum cannot vibrate properly, one has decreased hearing. Also, there is a feeling of fullness or pressure in the ear with dizziness, loss of balance, nausea, vomiting, and fever. Sometimes the eardrum ruptures and pus drains out of the ear. But more commonly, the pus and mucus remain in the middle ear due to the swollen and inflamed eustachian tube. This condition is serious because of the severe earache and hearing loss it can create. Hearing loss, especially in children, may impair learning capacity and even delay speech development. Otitis media is also serious because the infection can spread to nearby structures in the head. Thus, it is very important to recognize the symptoms of middle ear infections and to get immediate attention from your doctor. However, if it is treated promptly and effectively, hearing can almost always be restored to normal. Tips to prevent middle ear infections for infants. Appropriate management of colds, flu and sore throats and of hay fever and other allergies helps prevent middle ear infections. While breast or bottle feeding babies, avoid holding them in a horizontal position. A semi-inclined position prevents the milk from entering the eustachian tube and infecting the middle ear. Avoid contact of the baby with objects handled by people who have cold.